Hello, my name is Andreas Sihotang. I am a former project manager of social accountability project implemented by Wahana Fish Indonesia or World Vision partner in Indonesia, funded by the World Bank in 2014 2018.
Hi, I'm Rikardus Wawo. I am now as a social accountability specialist for Wahana Visi Indonesia, for vision partner in Indonesia. Actually, I was also support the project for Andreas team when the project implemented in by Wahana Visi Indonesia.
When we talk about who in the report, the, uh, the project evaluation report mostly talk about who World Vision is an organization in related to social accountability, and as an international organization, World Vision has adapted uh, social accountability approach developed by CARE, which is called Community Scorecard, and World Vision developed it to become a new approach, which is called Citizen Voice and Action, which combine the Community Scorecard and another tool for social accountability, such as social audit, or what they call uh, what they call standard monitoring, and making it into several steps or stages in the approach, and used it worldwide in many countries. And this approach was also used in the project implemented by World Vision Indonesia and funded by the World Bank. So this is basically what we discuss about the organization, who we are as an organization, especially in related to what we do, what experience we have in social accountability field.
Maybe I would like to add why Wahana Visi Indonesia choose the social accountability as one of strategic advocacy, because Wahana Visi Indonesia have like a 5 strategy imperative, and one of them is collaborate and advocate for broader impact. And also, as an organization, we are focused for our ministry to get the greater result. So, social accountability, World Vision as a global, and also Wahana Visi Indonesia as a trusted partner in Indonesia. See, social accountability can help government to increase the public service by involving people, involving a citizen. So through the social accountability, Wahana Visi Indonesia would like to empowering people to working together to have like a collaborative action with the government to improving the services. So and for the question why we choose the health for the project, Wahana Visi Indonesia see in as a Christian humanitarian organization, which work to bring like a sustainability transformation in the life of children, families, and communities, especially live in a vulnerable situation, condition, and poverty in Indonesia. And the main problem is about the health problem. There are in the high number of malnutrition, stunting. This is the problem of health, and we found based on our analysis, we found that the problem is the lack of access, the lack of the high quality of services in the health. So it's important to us as organization to collaborate and advocate the issue of the health.
Yeah, we also explain in the report why we choose the province or the districts that the project implemented in. And one of the main problem there is related to maternal and child mortality. And so the project itself aimed to address this issue by improving maternal and child health services, especially in villages or in rural areas. So by increasing the services, the maternal and child health services, we expected to reduce maternal and child mortality rate as well. We may discuss this. We may discuss the stakeholders and the context itself in the background section in the report. So we discuss about the districts where the project was implemented and the villages, especially in the district, in each district where the project was implemented. And we also discussed about the community members in the villages that we work with as village facilitators, and we provide some capacity building and training for community members in the villages who were voluntarily willing to be part as the project and took role as village facilitator. And we provided some workshops and training, and we work together with them to provide some activities related to social accountability. We such as implemented the community scorecard meeting, implemented the standard monitoring meeting, implemented the interface meeting with village government, health workers in the village through sub-district level, as well as the government at the sub-district and district level. So we discussed about this in the report, especially in background and also in project description itself. In one of the seminars, national seminars we held with the national government and local government about lessons learned and sharing practices from social accountability, we presented in the seminar that social accountability doesn't merely or doesn't necessarily mean confrontation, because in social accountability, when we speak about social accountability, formally it was defined as efforts to hold government accountability by engaging citizens or community at the grassroots. And by definition, there's there is a sense that because government is not accountable, then citizens should do some efforts to advocate or to endorse government to be more accountable by doing uh, activities to um, to push the government to be more accountable. And to some extent, this definition might imply some confrontation between community or citizens and the government. Um, but we know that this is not necessarily true because instead of a confrontation, actually, social accountability can also actually provide collaborative action between citizens and government to improve services. So this is one emphasis that we mentioned in the seminar with the national government uh, to get support and to build common understanding and common uh, or collaborative action between us as non-government organization and the community or the citizens that we work in the grassroots level, uh, as well as the local government and the national government. So this is how we uh, we define and we socialize about this social accountability.
I think it's true, and that's uh, I think based on our uh, experience and the implementation of the social accountability, so we can found the social accountability itself is like a process or strategic to how to improve government accountability by uh, bring the community citizen to have like a one table or in one collective collaboration action with their government to to see the gap, to see the problem of the public services or the policy implementation, and they working together, sit together, and then discuss, make like a conversation, in very communicative conversation between citizen and their government in the local government, and they set up the action plan, the action to improve the services. So I think the social accountability is like not true, like Andreas stated before, the not in the confrontation sense, but more and based on our experience in the implementation project, I think very collaborative dialogue between the citizen and the local the government or the social uh, service providers to improve the services.
So we emphasize on dialogue, not we emphasize social dialogue as a main part in social accountability. That's why one of the important step or activity in social accountability project we implemented is called interface meeting, where all the stakeholders sit together and discuss about what they find uh, in actual services compared to the standard regulated by the government. What are the gaps and what are the activities that should be carried out in order to fill the gaps and to improve services.